Hey y'all, welcome to week 36 and 38, pelvic floor and core stability in my movement through pregnancy program. I'm so excited that we are slowly making our way through the third trimester and we are so close to the finish line. I hope everyone is feeling good. I hope you've been noticing the workouts are really starting to taper in terms of intensity and recommended resistance, because at this point we're incorporating just a lot more mobility to prepare your pelvis for birth. So today we're working just your deep core, your posterior oblique sling, your obliques, just kind of this entire region, as well as a lot of mobility and breath work. So all the equipment that you need is listed in the description, as well as the circuit. Let's go ahead and get started. We're going to start with the seated diaphragmatic breathing and deep core contraction. You can hold the ball if you want to help with that deep core contraction. I'm just going to place my hands on either side of my rib cage. Thumbs are in the back of the ribs, and then your fingertips are in the front. Inhale through your nose, expanding 360 degrees. Feel your ribs expand 360 degrees. Then on an exhale, I want you to think about bringing your pubic bone up towards your sternum as you exhale through pursed lips. Engage that deep core. Hug that baby. I'm going to turn to the side so you can see. Inhale. Then exhale. Inhale. It's a lot harder for me to get full expansion on the right side. And then exhale. Hug that baby. Wrap that deep core. One more. Inhale. And then exhale. Alrighty, move back into a 90-90 position. We're going to do a hip switch with a hip thrust if you're able to. So start in this kind of reclined position. You're going to allow both of your knees to fall to the right. Then what you can do is kind of prop yourself up to get into that hip thrust. If you have enough strength to do it without holding on, even better. You're going to rotate your hips to either side and thrust up. Like I said, if you need a little bit of help, you can put your hands down. Or we're just working on opening up the pelvis in multiple planes of motion to get ready for birth. There are 3 levels to your pelvis, so you want to make sure that the exercise you're doing open up all 3 levels, which if you're in this program, you don't have to worry about it. It's all been programmed for you. Let's do one more to the right. Good. Stay in this 90-90 position. I want you to, we're going to do hip external and internal rotation. So you're going to lean forward, lift the back knee up for external rotation, drop the knee, lift the back foot up. Lift the knee, slowly lower, lift the back foot. So we're just working on getting hip external and internal rotation. Good, go ahead and switch sides. So you can slightly lean over your left leg. You're gonna lift that right knee for external rotation. Lean forward, lift the right foot. If you're experiencing a little cramping in the top of your hip, that's totally normal as you lift your foot. A lot of us are kind of weak in internal rotation strength of our hip, and so using these muscles feels a little difficult sometimes. Let's do one more rep. Lift that knee and then lift that foot. Moving into a quadruped position, we're gonna do those rock backs we've been doing so many times at this point. So you can have your feet either right in line with your knees or slightly wider. Inhale as you sit back, feeling your sits bones spread, pelvic floor lengthen. Exhale, rock forward. You can choose to also exhale as you sit back and then inhale as you rock forward, if that feels good for you. Both are going to work on pelvic floor lengthening. Meet me back in all fours. Grab your Pilates ball, place it under or in between your thighs. Hips over knees, shoulders over wrists. Inhale through the nose, expanding your ribcage 360 degrees. Then exhale, hug your baby. Wrap that deep core theme, engaging your core from the pelvic floor up. Press your hands away from the ground to engage the upper back. Maintain this position right here. Just perform shoulder taps. You have a gentle squeeze of the ball, and you're not moving your pelvis. Gaze is towards the top of your yoga mat. If you want to make this harder, you can elevate into a bear position and perform shoulder taps there. I'm not at that capability right now. First exercise of our strength circuit is a bird dog row, which we're going to move to in 3, 2, and 1. Move that Pilates ball out of the way. Grab those medium weights. I'm going to use 12 and a half, not trying to really kill myself this time, just working on good posterior obliques. Sling strengthening. So same good stack position, hips over knees, shoulders over wrists. Exhale, wrap that core. Let's start with extending the right leg and rowing on the left arm. In 3, 2, 1, let's go. I'm timing my exhale with the row and leg extension. This is not necessarily about lifting as heavy as you can with the row, so if you need to go down in weight in order to maintain stability in your trunk, please do so. We're more so focusing on posterior oblique sling strengthening, which helps to protect against things like SI joint pain and low back pain and sciatica. Nice and slow and control with the weight on the way down. No coning or doming. Think about squeezing that shoulder blade to row. You're also making more of a J motion with that dumbbell and elbow. We're going to switch sides in 4, 3, 2, 1. Right into that other side. Notice how still my trunk is. I'm keeping my deep core engaged the entire time, but I'm further wrapping my core, and as I exhale, extending the leg and rowing. Remember, it's not about how fast you go. It's about, can you do this in a super controlled motion? I should be able to put an open glass of water on your back, and it shouldn't spill. After this, we have a side plank, a modified side plank, with the option to add a dumbbell with rotation. So I'll show you all multiple modifications. 10 more seconds. 5, 4, 3, 2, and 1. Move those dumbbells out of the way. Grab your Pilates ball. Let's start on the left side. Modified side plank position on your knees. Start with that dumbbell straight up ahead. Inhale into the ribs. Exhale, wrap the core, squeeze the ball as you come up into a side plank hip lift. Option to add that rotation and then come back down. So, a couple of variations. You can get rid of the dumbbell altogether and still perform the hip lift with the rotation. So just look like this. Squeeze, rotate, release the ball on the way down. If that rotation is feeling too much for you, then what you can do is just perform a regular hip lift. So you're still squeezing that ball as you come up, still pressing the bottom knee through the ground. So with the dumbbell is going to be the hardest, and then obviously no dumbbell, no rotation is going to be the easiest. We're going to switch sides in 5, 4, 3, 2, 1. Make sure the shoulder is directly over the elbow. Inhale to prepare. Exhale, thrust up, and rotate. That rotation feels really good. There's a fly on my arm. Feels really good on the left side because as I rotate my left arm through, I'm getting good expansion in the right side body, which is where I get really, really tight. Most people do just because of the shape of our organs. We tend to get more compressed on the right compared to the left. And then you add in holding your toddler on one hip, and you tend to get even more compression on that side. Next exercise will be a hamstring bridge. So you'll need your bench and your Pilates ball. You'll be on your back with your feet elevated on the bench. We're going to move to that exercise in 5, 4, 3, 2, 1. Put that dumbbell down. Let's move on to our backs. You're going to roll to your side. Place that Pilates ball between your knees. Hips, ankles, knees are 90 degrees. Reach your arms up towards the ceiling. Inhale, expanding the ribs 360 degrees. Then on exhale, I want you to think about gently squeezing the ball. You tuck your pelvis underneath of you using your lower abdominals and drag your heels towards your butt. This will cause a little lift off of your pelvis, just a couple of inches off the ground. My hamstrings were cramping there. There we go. So make sure you're not digging too hard that they cramp. But you really want to reach here. Inhale. Feel the back of the ribcage expand. Exhale, further wrap that deep core. You're not squeezing your butt cheeks. We're just holding this isometric position, pressing those heels into the ground, thinking of dragging them towards you. That's going to help bring your pelvis into a posterior tilt. Gentle squeeze of the ball. Big inhales into the back body. Exhale. Just further wrapping that core. Relax your butt cheeks. Wiggle them around if you need to. We're almost there. You have 5, 4, 3, 2, and 1. Lower yourself to the ground. Get that Pilates ball out of the way, or you can use it for the quadruped dumbbell slide. I'm going to roll my mat back. Place that Pilates ball between my knees. Alrighty, start with that dumbbell outside of the plane of your body. Then inhale, exhale, wrap the deep core, slide that dumbbell to the opposite side. You're keeping your deep core engaged the entire time. You're just further exhaling and wrapping that deep core as you slide the dumbbell underneath your hands. Gaze is slightly in front of you. This is our last strength exercise. Then we're going to have some adductor rock backs to open up the pelvis a little bit before we begin round 2. Keep the trunk still. The slower you drag that weight with more intention and control, the harder it is on your core. Gentle squeeze of the Pilates ball. We got 4, 3, 2, and 1. Alrighty, let's do some adductor rock backs. Start on that right knee. Extend the left leg long. Inhale as you sit back. Oh, it feels good on the inner thighs after those hamstring bridges. My inner thighs got a little bit of work in there. Squeezing that ball. We're just going to do about 30 seconds on each side, just as a little bit of a mobility break in the middle of our circuit. Switch sides in 3, 2, 1. You're on your left knee. Right leg is long. Inhale, sit back. Toes are pointed forward. Or you can even point them up towards the ceiling as you sit back. Doing a little flossing of the inner thighs. Nope, got a little pop. Moving back to our bird dog row in 3, 2, and 1. I'm going to grab a little sip of water. Grab those medium dumbbells. 12.5 for me. Alrighty, get in that all fours position. Inhale to prepare. Exhale, wrap the deep core. Let's row. Starting with the left side again, left row, right leg extension. If you hate this and you're like, I don't want to do any weights, I'm so sore in my body, move the dumbbells out of the way, and you're just doing your regular bird dog. So you're still getting good posterior oblique sling work, you're still getting good upper back work, but it's not as loaded of an exercise as the bird dog row. Make sure when your knee comes back to midline that you're going slow and controlled. You're not just allowing it to collapse inwards. Go back to my row. 10 seconds left, and we're switching sides. Switching in 5, 4, 3, 2, and 1. Right into the opposite side. Keep the gaze towards the top of your mat. Press your hand away from the ground. Keep that upper back engaged. Core is staying engaged the entire time. If you want to challenge yourself, you can go heavier with the weight. My upper back was just already so tired from the workout earlier in the week for upper body, so just a little tired. And this is more for stability, not necessarily hypertrophy of your upper back. We're working more on muscle coordination and breath work and control with your pelvic floor, so don't need to push the weight. Moving on to our side plank in 4, 3, 2, and 1. Set those dumbbells aside. Grab your Pilates ball. I'm starting on the left side again. Remember, dumbbell is optional, and so is the rotation. Set yourself up, shoulder directly over elbow. Inhale to prepare. Exhale, lift up, rotate. I like to follow the dumbbell, I like to follow the dumbbell with my eyes. And my neck works a good balance challenge by moving your neck through space. And also just puts less stress on your neck. Make sure you're pressing through that bottom knee. Switching sides in 4, 3, 2, and 1. Move on over to that right side. Pilates balls between the knees. Inhale to prepare. Exhale, lift up, rotate. Your hips will come slightly forward as you perform this hip lift, side plank. So they kind of sit back, then they come forward as you rotate. Make sure you're not experiencing any coning or doming as you perform this movement. If you have no idea what I'm talking about, make sure you've watched the educational videos on all things core. Moving on to our hamstring bridge in 5, 4, 3, 2, and 1. Set the dumbbell down. Keep your Pilates ball with you. Hamstrings are an essential part of pelvic health, so that's why I include them a lot in the pelvic floor and core stability days. Alrighty, get your feet in that 90-90 position. Reach up towards the ceiling so you round your back. Inhale, then exhale. Squeeze the ball gently. Round your pelvis by pulling or dragging your heels towards you. Relax the butt cheeks though. It's really common to want to tuck and squeeze the butt cheeks. The way that you're getting that posterior pelvic tilt is by dragging your hamstrings towards you. Really round that back, reach up to the ceiling. Inhale, feel that expansion in the upper back. Exhale, drag a little bit more. Woo, this feels good. It's a nice reset for the pelvis. Remember, your hips aren't lifted super high off the ground. Just a couple of inches. You got 5 seconds left. 4, 3, 2, 1. Release the ball. You can move it out of the way, or you can keep it nearby for the dumbbell slide. Whatever you want. Roll up my mat. Get my dumbbell set. I like using the ball for that increased deep core engagement. Alrighty, hips over knees, shoulders over wrists. You know the drill. Exhale, engage the core. Exhale, further wrap as you slide. Stay engaged in the upper back by pressing your hands away from the ground. Don't squeeze your butt cheeks. I just found myself clenching my butt cheeks. It's just a gentle squeeze of the ball using your inner thighs. No need to tuck underneath. Your trunk is in a neutral spine position. If you're feeling really strong and you want to perform this in a bear pose, go ahead. I cannot without experiencing significant coning or doming. Good job keeping that deep core engaged. 10 more seconds. You got 5, 4, 3, 2, and 1. Remove that Pilates ball. Get your mat back to where it was. Adductor rock backs, starting on that right knee. Left leg is out long. Inhale as you sit back. Feel that pelvic floor lengthen. Sits bones. Expand. Feels so good. Working on opening the mid-pelvis and a little bit of the back of the pelvic floor. So remember, mid-pelvis opens with asymmetrical movement, which is this. And then posterior pelvic floor opens up with like deep squat positions, as well as knees in, feet out. Let's switch sides. So we're getting a little bit of both. Just have one more round. Starting back with that bird dog row again. Keeping it simple this time, not switching up the exercises with each circuit. My brain capacity is not quite there as I reach the end of this pregnancy. I feel like there's still a million things that I need to do and get ready in our home. Bird dog row in 3, 2, and 1. Grab a sip of water. Make sure you are hydrating throughout your pregnancy, y'all. Alrighty? Inhale to prepare, exhale, wrap the core. I'm going to start on the right side with the row this time. And by hydrating, I mean not just water. So around 64 to 96 ounces, fluid ounces of water per day is what ACOG recommends for optimal water intake or fluid intake in general. This might increase if you're in a hotter environment or sweating more. But you also want to make sure that you are getting good electrolyte intake as well. A lot of times people think it's just water, but really you need sodium and potassium and chloride as well. And magnesium to maintain proper hydration. I use little electrolyte packs. There's a whole bunch of brands out there. I prefer ones that aren't too salty or sweet. Switch sides in 5, 4, 3, 2, and 1. And so you want to make sure that you are staying properly hydrated via electrolytes and your mineral balance as well, especially going into labor. You don't want to go into labor dehydrated because your uterus is a muscle that contracts to contract downwards. It basically squeezes out your baby. Your pelvic floor just relaxes. Your uterus and your abdominals kind of do all the work. So if that muscle, when you become dehydrated and you can't fuel your muscles properly, you might have a decrease in the strength of your contraction. So it's really important to go into labor properly hydrated, not just with water, but also with your minerals, and then keeping up with it postpartum, especially if you are breastfeeding, because you'll get dehydrated real quickly. Breast milk is largely made up of water, so you need to really stay hydrated with minerals, electrolytes, and water intake. Breastfeeding. We got 3, 2, and 1. Last time doing those rows. Grab your ball, side plank, hip lift with that rotation. Start with that weight straight up towards the sky. Inhale into the ribs. Exhale, lift up and rotate. Bet you weren't expecting to get a lecture on minerals and electrolytes in the middle of your workout, but you know, us moms, we're short on time, so if you can pair a workout while also being educated on all things pregnancy and labor and postpartum recovery, why not? If you're interested in like the specific electrolytes I use, make sure you check out the product recommendations that are in the app. And if I ever get discount codes, I try and put them in there as well. Always trying to save y'all money where I can. Switching sides in 4, 3, 2, and 1. Alrighty. Ooh. Put that ball between your legs. Arms straight up towards the ceiling. Inhale to prepare. Exhale, rise up, rotate. Good work, y'all. This is not easy to do during pregnancy. It's honestly a shoulder workout too. Make sure you're pressing your forearms through the ground so you're not sinking into your shoulder. I don't want you to think about overly contracting your pelvic floor. If you can feel your pelvic floor naturally lift, no need to think about it. Just think about that deep core engaging. Stick with me, last 10 seconds. Get the hamstring bridge in 3, 2, 1. Whew, working up a sweat with this one. Roll onto your back, feet elevated on your bench. Reach the arms up towards the sky, rounding the back. Inhale into the ribs, then exhale, gently squeeze the ball. Drag your heels towards your butt. Relax the butt cheeks. If you were to touch your sits bones, you should be able to feel your proximal hamstrings be tense. So it's nice and hard in the muscle, kind of up to the close to the sits bone. But then your glute, your fleshy glute, is nice and relaxed and jiggly. All right, quads are also relaxed and jiggly. So the only things that we want to work here really are the inner thighs and the hamstrings, helping to restore that natural posterior rotation of your pelvis, which allows the pelvic floor to fully relax and fully contract in a more optimal position. When you're too anteriorly tilted, it can put a big stretch on the pelvic floor, making it harder for it to both contract and relax. Reach up. We got our quadruped dumbbell slide in 5, 4, 3, 2, 1. Roll to your side. I swear these workouts just take longer, just from rolling to my side and getting up. I feel like a roly-poly these days. All right, this is our last exercise before we move to our cool down with lots of mobility. So make it a good one. Hips over knees, shoulders over wrists. Inhale. Exhale, engage the core. Slide. Last minute of work. So I'm 36 weeks right now, and had my prenatal appointment yesterday with my hospital-based midwives. They did the GBS swab, so fingers crossed this time I am negative. Last time I was positive. It can come and go. You can honestly be positive and negative within weeks of each other, so if I do test positive, I will test again at the next visit, because I really don't want to have to take antibiotics during delivery if I can help it, just because being hooked up to an IV makes you a little less mobile. And there's some good research that it can affect your baby's gut microbiome. But at the end of the day, you know, I want to do whatever is best for my baby. So if I do have GBS, I'll personally will opt for the antibiotics because a NICU stay, sorry, that's the end of the exercise. A NICU stay for my baby would just not be something that I would want to desire. So if I can prevent my baby from getting GBS, even though there's only like a 1 to 2% chance, I will take the antibiotics. Alrighty, so I'm doing so much education through this workout today. But as always, y'all, I'm not your personal medical provider, so always have these discussions with your provider about antibiotics, non-antibiotics, GBS, all that sort of stuff. I'm just kind of sharing my experience, both as a pelvic floor physical therapist, but also just as a mom of soon-to-be two. But please, 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 always speak with your individual provider. All right, let's go down to our cool down. I'm gonna grab my pillow. We're gonna work on some down training of the pelvic floor in a puppy pose. So put that pillow underneath your belly for a little bit of support. Extend the arms out long, booty up towards the ceiling, feeling the sits bones spread. I want you to place your hands on your anal sphincter. Inhale, trying to direct your air down into your hand. Feel the sits bone spreads, feel a little bit of pressure into your hand at the anal sphincter, then exhale, let it go. Inhale. Then exhale, just let it go. Inhale. Exhale. Let's do 2 more. Inhale. Exhale. Last one. Inhale. And exhale. Good. If you need to spend more time in that position, please do. But feeling that pelvic floor lengthen is really crucial at this point in pregnancy because we really want to make sure you're not holding tension in your pelvic floor. All right, the rest of the movements for our cool down are on our birth ball because it feels good to sit on that bad boy these days. I swear I have to sit on it for like every meal or anything at this point because there's just, especially eating, there's just no more room in here. All righty, start with your arms in front of you in a 90-90 position. Inhale, reach up or look up towards the ceiling, squeeze the shoulder blades, arch your back. Exhale, round and tuck. It's like a seated cat-cow with the goalpost arms. I'm rounding, tucking my pelvis. The ball rolls forward. As I arch my pelvis, stick my butt out, ball rolls back. Last one. Good. Hold on to your ball. Cross your left foot over your right knee. Hand gently on that left knee. Hinge forward at the waist. Feel a stretch in that glute. Just feel a gentle stretch. No need to push too far into it. Just holding it here. Just breathing into that glute. Remember, your glutes and your pelvic floor are BFFs, so if you have a lot of tension in your glutes or weakness, a lot of times you'll have the same thing in the pelvic floor. Switching sides in 5, 4, 3, 2, 1. Gently hinge forward. You can add a little bit more stretch by gently pressing that knee down towards the ground. This feels so good. Remember, your body's already pretty elastic during pregnancy. You have a lot of tissue laxity. So just because the stretch feels good doesn't mean it's always what's going to solve your pain or your problems. A lot of times people do a lot of hip stretching. You can relax to try and alleviate hip pain, and it might feel good in the moment, but then it kind of comes back. So remember, stretching is not the be all end all. Let's do some overhead reaches. Reach up with your left arm over to the right, and then come down. Up and reach. Inhale into that side body. Exhale as you come down. 2 more. 1 more. Other side. Got a little bit of cracks in the side of my lower back. I'm always so stiff there. 1 more. All right, I want to end with just some diaphragmatic breathing, sitting on your ball. Reposition yourself if you need to. Make sure you're pulling apart your butt cheeks so your sits bones and pelvic floor are in good contact with the ball. We're just going to do some diaphragmatic breathing. Close your eyes, hands on either the sides of your ribs or on your belly and lower sternum, whatever feels good for you. Inhale through the nose. And then exhale, just let it go. Inhale, feel your pelvic floor lengthen into that ball. Exhale. Let it go. 2 more. Inhale. Exhale. Last one, big inhale. And exhale. Amazing. Congrats, y'all. You made it through another workout in your pregnancy. I hope everyone's feeling good. As always, if you have questions about cues, modifications, pregnancy in general, please put them in the group chat. Make sure you are utilizing those birth prep mobility flows to add on either active rest days or in addition to these workouts. You really can't do the mobility work enough. So a lot of times people like to do them every single morning or every single night. It's kind of like a wake up in the morning or kind of a cool down right before bed. But I cannot wait to see y'all for our next workout, and hopefully you'll be here for the next workout and baby won't come just yet. But if baby does come, congratulations, and I hope all goes really well.